Thank you everyone for joining in. This is our laser call today. I know we had some questions and some requests to talk about headaches and migraine headaches. We have a special guest today, and I'm going to bring him on. Hope I can bring him on camera. Dr. Filner, are you there?
I'm trying to get on.
Well, we can hear you, so that's okay. Can you see us?
I can see you all, but this computer is acting up.
Well, first of all, welcome back, Dr. Filner. We all missed you, by the way. Oh, there you are. We
There
can
I
see you.
now I
Yes, look
have
at
I
that.
have a PubMed thing on my I can't get off.
That's okay. I have that on, Dr. Filner. Yeah,
Oh,
I
okay.
have that on. We're going to talk about headaches. So I just wanted to have something open so they can reference them themselves afterwards. So I just brought up some of the National Library of Medicine. I brought some PubMed article up because today's topic is really focused on migraine headaches. And so, and headaches in general, and some specifically the harder ones, the more difficult ones, migraines. So, welcome, Dr. Filner. It's nice to see you back and working with us again.
Glad to
And
be alive.
we're glad you were alive. We had a lot of people praying for you and a lot of people asking how you're doing. And so it's nice to have you back and us start going on the circuit again preaching the laser therapy. And the great thing is we are getting a lot of traction around this laser. A lot of people are asking, about it. We're also getting incredible results using this laser in parties, and some of our reps are being booked out, and it's just going in harmony with what we're doing of bringing humanity back to nature. And the infrared light has been around. I'll turn it to Mike real quick here because this is what Dr. Filner would rather you mention is the science, Mike, on, this technology is, let's go back to let there be light, but let's talk about the technology of 830 nanometer and its power and why we get so many great results from using this laser for pain management and or discomfort or just being sore. I know we treated someone last night. So Mike, let's talk about that on the history of this. And then I'll turn it to Dr. Filner. And if you would mind introducing him properly on his experience and why he's part of your team and helps us here educate humanity on this.
Well, Kim, first of all, thank you for having us this afternoon. And in Texas, we'd say, Dr. Filner, you're back in the saddle again.
True.
That's how we would say it in Houston, Texas. Doc, welcome back. You're in the saddle again. But the science, Kim, comes out of Japan. My background is surgery in the operating room, teaching docs how to use class 4 lasers in the 80s, latter part of the 80s. And I picked up on this science in 1990, brought it to America, hooked up with General Motors. We did a double blind study, got the first clearance in 2002. And as we talk here this afternoon, we've sold over 20,000 lasers around America and around the world. So it's
Wow.
all about the science. It's about how this particular wavelength has a unique tissue interaction. We patented and then we renewed the patent, as you know, to include CBD oil a couple of years ago.
That's amazing. And I know some of our affiliates are already graduating. We have some people that want to take a lead here and start using this laser and start, getting clients. And so it's exciting because we just congratulated Marta, would be the first one certified in Sweden. And then we had also Sylvia Voss, was the first one certified in Hungary. So these two now, they have a laser and they're going to go hard on getting the information out there, getting people in front of this information, using it to get some great testimonies. So if you wouldn't mind, Mike, if you want to introduce Dr. Filner as one of your amazing team to help us educate.
Yeah, how about one of a kind?
Yes.
So, just a minute or two, Doc, before I introduce you, just a background. I get a call from Dr. Filner probably 2005. There'd been a big article in the Washington Post about the New England Patriots running back, got treated with the laser, won the game, become the most valuable player. And Dr. Filner called and said, I'd like to learn more about it. He did, and he began treating a lot of his specialty is pain management using needle injection therapy to deactivate trigger points. And he found that the laser could do it faster, better, and quicker. So the last 15 years, Doc, 16 years maybe?
20.
20. Okay. We're getting older. We're getting older, Doc. So for the last 20 years, he treated hundreds and hundreds of patients, probably thousands of patients, using the laser in place of needle trigger point therapy. So, Doc, take it away. First of all, your background, MD, anesthesiologist.
Right. I was an anesthesiologist for 19 years. And then I developed Meniere's disease, and I got de-insured for working in the operating rooms. And luckily, I had met Dr. Travell a couple of years before, and she suggested I start a pain practice. And she referred a bunch of patients to me, and we used to meet every week or two to discuss cases. And I worked with her for about 10 years. In the first, I guess, the first 15 years of my pain practice, I did 600,000 trigger point injections. And I can count on one hand the number of times I missed the trigger point. And in 2004, I heard about this, and I thought it was not ideal, but I called anyway. And Mike's brother, who was the sales manager, came to Maryland and brought a laser with him. And that time it was a flashlight type laser, and included a charger and a whole bunch of other things. And I brought in 6 of my patients, and I showed him where to use the laser on me, because I have trigger points in my neck and upper back, and they inactivated those. The laser inactivated those trigger points in me, and then I used it on 6 of those patients that were there that day, and it worked on all of them. So I bought it on the spot, and back then it was $10,000. But I started using it, especially in sternomastoid muscles, because that injections tended to cause people to get a little dizzy. And then I would say within about a year, I had stopped doing injections pretty much, except for rare occasions. And I've used the laser ever since.
Doc, you talk about your migraine headache protocol,
Yeah, I'll mention that in a minute.
Okay.
I've inactivated over 400,000 trigger points with the laser now. And I closed my practice in 2019. I'm 79 now. So I've dedicated the rest of my time around here to getting people to start using the laser, because it's so much more effective. It has basically no pain, and it's risk-free when used properly. Over the course of time, I've treated a lot of people for migraine headaches or alleged migraine headaches. Unfortunately, the neurologists are not as they don't know as much about trigger points, and they over categorize headaches as migraines. To my way of thinking, a patient has a migraine if they have a single-sided headache and an aura, meaning smell, some visual problems, changes like that. Then that's a migraine. The other headaches can be a migraine, but they may not be. And you just have to differentiate that. And in my practice, I've noticed that all migraines start from trigger points in the primarily in the neck. And once they cause a severe headache, it can turn into a migraine in susceptible individuals. Prior to the time that I developed this, actually I went to visit a lecture by a dentist who was using 3.5-inch needles to reach the sphenopalatine ganglion. And he said that every one of the patients got a black eye. And the only reason they either had it a second time or wanted it was because it was effective in stopping their headaches, at least temporarily. And I asked him what would happen if we used the laser. And he said he didn't know because he hadn't used the laser. So I went back to my practice and I started using the laser for the trigger points in the neck first. And if a headache persisted, I figured out a way to aim the laser to the sphenopalatine ganglion, which sits just below the nasal passage. Most people think the nasal passage goes up when in fact what it does is it goes straight back. And underlying the lining of that nasal passage is something called the ethmoid plate. And then just below that is the sphenopalatine ganglion, which has a mixture of both adrenal and other, I guess they're both types of active cells that will control the circulation in the brain. So there's an underlying scientific reason why the sphenopalatine ganglion is a good target. In fact, if you use Botox and you limit the Botox injections to here in the glabellar area, the Botox will diffuse down and go to the sphenopalatine ganglion. And that's the only area where Botox is actually effective in stopping a migraine. But after a few weeks of working on it, I was able to consistently hit the sphenopalatine ganglion with the laser. And this resulted in stopping a migraine headache in 6 minutes. And I've been able to do that. Actually, it was about a little more than maybe a year and a half ago that there was a conference in Minneapolis where at a previous pain week, I had met the director and the assistant director of this group of migraineurs, and they were having their conference in Minneapolis. And several of Mike's helpers and salespeople attended with me. Unfortunately, they didn't have a slot for me to give a talk, and they certainly would have over time. But I treated almost every one of the patients who came to that conference, including a very dramatic woman who used to get, she was in her 20s, and she used to get a true migraine headache every time she opened her mouth more than an inch. So she had trouble eating for over 20 years. And she was really desperate to have some change. And she came to the area where we were treating people. And I found that she had trigger points in her masseter muscles. So I inactivated those trigger points with a laser and then did because she did have a headache. And I inactivated the sphenopalatine ganglion, and she was instantly able to open her mouth about 1.5 inches to 2 inches, and her headache was gone. And this was, I think, the most dramatic of all the people that I treated there. but every one of them had a good response to the laser treatment. And in my own practice, before I retired, I had a series of 12 patients that came to me. They were either the children of patients that I had or patients that I had treated for another problem, who pointed out that they had migraines and that no treatment had worked. And that included Botox, all the available medications at that time. And so I started treating these people by inactivating the trigger points in their neck first. If they still had a headache, I used the laser to hit the sphenopalatine ganglion. And initially, 4 patients with, I think, at most 2 or 3 treatments, their headaches were gone permanently. And I was able to, just before I closed my practice and retired, I was able to finish the other 8.
Yes.
And all 12 are headache free at this point.
It's amazing, Dr.
And
Amazing.
I have a commitment from a editor of a pain magazine to print the case report, basically. And I hope I would have gotten that done this past year, but I was indisposed from June through the end of the year. And I hope
Nice
to
to
get
see you
that
back.
all done shortly. But basically, there is a video on YouTube that shows the technique. And basically, the laser is placed just above the zygomatic arch and is aimed slightly down and slightly forward, which is where you will hit these the sphenopalatine ganglion. And for most people, it only takes maybe a week or so of trying till they get it. And as I say, you can stop a migraine headache in 6 minutes. And by starting to treat the trigger points in the neck, you eliminate a lot of the misdiagnoses that a patient has had migraines when in fact they don't. They have myofascial headaches with trigger
Interesting.
points causing the problems.
That's interesting. We have some
and-
questions, Dr. Filner. You ready for
Sure.
some questions?
Sure.
Okay. All right. Hold on one second.
Hey, Dr. Filner, it's Sarah. So one of the questions is, someone had asked if the laser helps bone on bone. They're actually waiting for knee surgery now.
If they're having a lot of arthritic symptoms in their knee, a laser doesn't work on bone particularly, but it does work on muscles that attach to bone. And when you have trigger points, let's say in the thigh and in the calf, they may refer to the knee joint. And because it keeps the joint tighter together. And if there's any type of arthritic problem, that aggravates the symptoms that a person has. So what I would do if somebody came to me with bone-on-bone MRI scan that was having significant pain, I would look for trigger points in the thigh and calf. And if that didn't work, then, I think you're dealing with a problem that needs to have surgical intervention. In my experience, probably 3/4 of the people who I saw with just those symptoms of bone-on-bone and arthritic symptoms in their knee, dealing with trigger points in the thigh and calf, I was able to allow them to defer their surgery for a year or 2 and still be able to walk up and down steps. So that a lot of the symptoms of any arthritis, whether it's in the knee or the wrist or other things. Trigger points are involved in all of these pain problems. Just a question of whether it's the only problem or part of the problem. And using the laser, which has no risk and no pain associated with it, makes it very easy to eliminate the trigger points as part of the problem.
Well, that was very helpful. Thank you for the answer, Dr. Filner. When you talk, let's say someone's watching this, Dr. Filner, and maybe they have on and off migraine headaches. They can think as migraine headaches. So let's go through, I know you touched on this, but let's talk about a little bit, if that is that individual and continually, consistently has headaches, and they, let's say you were actively practicing and they walked into your practice. What's the first thing that you do? And the second thing, I mean, I want to see what your protocol is. I want to hear that.
Well, the first thing I want to know is under what circumstances the headache starts, whether it's something that triggers it or whether it just, happens with their activities of daily living. And then I'd want to know exactly where their pain is. And my practice had these questionnaires that included a picture, a diagram of the body, and in cases of a headache of the head and neck. And the patients would put an X on the places where they felt pain. Then the next thing I would do is look at their neck and upper back for trigger points that refer into the area where they have their symptoms. If that results in a complete resolution of the headache, then I know they don't have migraines. What they have is myofascial headaches. And then if their headache persists, and especially if it's on one side with an aura, but it can be just a generalized headache. After I've looked at all of the possible trigger points that can refer into their area of symptoms, I'll do the laser aiming at the sphenopalatine ganglion. And that should resolve their headache, as I said, within about 6 or 7 minutes. And that's basically what you're doing is you're taking a pain history where you want to know what sets off the pain, where they feel it, under what circumstances, if it's weather sensitive, things like that, that will indicate more likely trigger points versus migraine, or more likely migraine versus trigger points. And just like the diagnosis of migraine can, be all over the place in the sense neurologists have come up with abdominal migraines and all sorts of things. Those tend to be myofascial in origin. And again, after I've practiced pain medicine for 35 years, I've come to the conclusion that every type of chronic pain has some component of trigger points. And once you eliminate those, and that can happen with one treatment or a couple of treatments, then you have to look at what is left, what symptom is left. And if it hasn't been affected by dealing with the trigger points, then you have to think about referring the patient to another practitioner, whether a surgeon or a neurologist, to handle the underlying problem.
Amazing. I know you're going to answer a lot of questions for some of our individuals, partners who have a laser and are using this to help individuals get free from a lot of their long-term discomfort. And also this knowledge is getting out also, Dr. Filner, in the masses. So we really want, that's our goal, is to get more people in front of this 830 nanometer technology, because it is so powerful. And I know initially you were a skeptic when this first got introduced to you, but you've actually decided you saw your own evidence, you proved it out, and now 20 years later, you're still here, right?
Yes, I'm even more so. I'm now in the last, I guess, the last year, especially since I was sick. Uh, I've been using the laser on my own neck pain and other places that I can reach. Uh, and I've been seeing a physical therapist who I did in services on 2 sessions with the laser, and that has given me temporary relief, at least, from the underlying problems that I had since last June.
That's amazing. You probably this somebody that you helped educate on the laser, Dr. Filner?
Oh yeah, I have aside, I guess in the last 2 years especially, uh, I've done quite a few Zooms with people in other countries and to uh, PT practices that had been doing dry needling, things like that. And I consulted with them and got them to use the laser instead of dry needling. And a lot of them began using the laser because it the patients demanded it because it's painless. And anybody who's had dry needling uh, usually doesn't want it more than once because the pain is there. And if the practice has a laser, uh, people will come to that practice preferentially because they can get treated with no pain and no risk, which
Yes,
someone
because
who's
there
had
are
chronic
risks.
pain is invaluable.
And when you agree, Dr. Filner, there are risks with dry needling, right? I mean, you're penetrating the skin with a needle.
Yeah, dry needling can hit blood vessels, can hit nerves. If you're doing things in the neck, it can go through the dura so that you get a total spinal. That's been reported.
Hmm.
Uh, and I mean, basically, dry needling usually requires penetrating the skin to find the trigger point with a number of penetrations. And that's what causes bleeding and discomfort for days sometimes after the treatment.
Wow. So if you're listening to this talk right now and and you're like, I want to know more, reach out to our team. We'll help you get that information that you need to make a decision whether or not you want to carry this in your practice or you want to become certified yourself. This is exciting technology. We're on the forefront of, even though it's been around a long time, there's a tipping point where most people don't know about it. Where that is starting to see a shift where laser technology is becoming more mainstream, but then all lasers aren't created equal. So let's go, Mike, as we close out, because we're couple minutes over, why don't we talk a little bit about not all lasers are created equal, and then we'll go ahead and close it out here. And you guys can watch this video later if you missed it, or share it with somebody you love and care about. If maybe they suffer from headaches, they might want to know about this and as an alternative therapy. So Mike, let's talk a little bit about, that question, like why there is a lot of lasers out there. I mean, we know you were the first FDA cleared device in US. You went through all this crazy trailblazing, being the first, and then what happened?
Well, what happened, it gets deep into the weeds of how you work with FDA, but they turned my PMA, which means pre-market approval application, into a 510K, which meant that other laser companies could use me as a predicate device. But because I had the power and the wavelength patented, I had to sue a couple of people. They couldn't use my power and wavelength. But when you're looking at lasers, there's a red label on every laser, and that's by law. FDA makes a laser company put their power, their wavelength, and classification. The class 4 lasers are going to range someplace between 500 milliwatts to 10 to 20 watts of energy. And I call that a blowtorch. That's essentially what they're doing. They're heating the tissue up, so they have to pulse and superpulse, otherwise they'll burn the patient. The other devices out there, and I'm not going to mention any names, if you looked at the label on their laser, it will say 635 nanometers at 10 milliwatts of energy, class 3A laser. That's the same power and wavelength of a laser pointer. So are you saying, Mr. Barber, that there are companies out there selling laser pointers to people that think they work? I say yes, because that's what the label on the laser or the label on their laser says. So
Well,
look at the
yeah.
labels. Look at the labels.
And maybe let's talk about this a little bit too, because we're talking about penetration and the
Yep.
anaphoresis. So are those individuals who have gone through the laser certification course, they're now going to be able to accept clients and use this into their practice and or their therapy, if they're a physical therapist or just someone that's and treat people with for the laser. So you moved forward with this patent. And because you saw some really great evidence of using cannabinoid therapy with infrared light therapy, so you went to move and got the patent, right? So something you saw that triggered you, no pun intended, to move forward to get the patent. So you want to share a little bit about that story? I wanted to address this real quick because we get this question a lot, is what is the partnership between Cocoa Vita and Microlight? And this is where we came into the picture, because Microlight was looking for a CBD provider that they can trust. And everybody knows that all of our doctors are big advocates of this technology. They have it in their practices. They educate people on it. And Mike also knows that Cocoa Vita is stickler on quality, ingredients, and affordability. So, Mike, talk a little bit about, you moved forward and got the patent here, and then you looked for it and we found Cocoa Vita partnership.
Well, obviously, Dr. Filner was part of the research. The word ionophoresis has been around, and the technique for ionophoresis has been around, what, Doc, 30, 40 years, something like that?
Oh, at least. Yeah.
And so what we found was that using the 830 wavelength, we could use photons versus electrons to drive in this particular case, the CBD oil deep into the tissue and have a pain relief response. And Dr. Filner can explain that pain relief response a lot better than I can.
Yep. Basically, physical therapists and chiropractors have been using this technique for decades because they can't inject anything into the body. So what they do is they set up a situation where you have two electrodes and a source of electricity. And by using the electrical activity on the active electrode, it pushes steroid or another medication into the tissues, and the circuit is completed with the other electrode that doesn't have any compound in it. And they're able to push steroid and some other medications into the patient by doing that. By using what we do know is that the 830 laser changes the underlying tissue so that by increasing circulation and moving compounds out and other compounds into the local tissue, it changes the ionic environment. So what happens is that when you use the CBD along with the laser, it in fact affects the underlying tissue in much the same way that the old iontophoresis technique did. And you don't need another electrode to be able to do that, because the underlying tissue becomes the second electrode, and you're able to get the electrical activity that's generated by the laser. It's all electromagnetic energy, whether it's a voltage battery or a voltage generator or a laser. It all has the same electrical characteristics. So by using the CBD to facilitate the transfer of the laser beam into the local tissues, and the local tissues have been changed by the laser activity, it allows for the marked increase in activity of the changes that the laser has made, so that it flushes out compounds that are causing the pain and allows new compounds that are pain relievers to come into the situation.
I love this, Dr. Filner. Amazing. I know it's kind of geeking people out, and that's okay because we have a lot of people that are passionate about learning new technologies, innovative, natural healing for either it's herbal but our company is a back to nature company. So we try to look for things that are less invasive, are getting great results. And this is currently in I think over 25,000 practices currently right now. If you are looking at carrying this, please reach out to one of our team here. You can go to our website too and learn more here. You can also message us at the bottom, but you can get all your information. And then if you need to jump on another call to get some questions answered, we have a team of support that can do that as well. So thank you, Dr. Filner. It's nice to have you back on board with us, back in the saddle, as Mike would say.
I might add one thing. The interesting thing is in the last 2 years, where people have developed long COVID after having COVID,
Mm-hmm.
their symptoms are very similar to fibromyalgia.
Okay.
And I've actually consulted and allowed people or got people to treat these a couple of these patients and have gotten the same good results that we do with fibromyalgia. And the chronic fatigue and a lot of the other symptoms are very similar to fibromyalgia,
That's
which
interesting.
I learned how to treat and got patients resolved from their fibromyalgia using the laser.
Wow.
You
That's a
can't do
great.
any injections on them because they're so sensitive to any kind of painful things that the
Mhm.
laser is ideal for people with fibromyalgia. And I think it will, if there are enough practitioners who are willing to use it on people with long COVID, they'll get some very good results.
Well, here's the cool thing. Well, this year, thanks to Cocoa Vida team and Microlight's partnership with Cocoa Vida, this will be the first time ever in history that the Microlight laser will be featured at the A4M event in May. And we will be there with our singing praises to the lasers therapy. It changed my life. And this is why I show up and want everyone in the world to know about this because it literally changed my life. And there's a lot of other people behind me. And I want to thank you, Mike, for leading the way for a technology that has helped a lot of people without hurting them physically. And I thank you, Dr. Filner, for partnering with Microlight and helping us navigate through the science side of this. And on a treatment perspective, as a medical doctor, your perspective is invaluable. So I thank you guys for tuning in today. It's an honor to work with you all. And we're just getting started here. And we're excited to have you back on board, Dr. Filner, and you'll see a lot more of him as we continue these webinars that'll help educate the masses about this technology and this device. And we want as many people to be able to acquire this device and share this around the world and help people live a better quality of life. So, Mike, anything before we close out?
No, great to see Dr. Filner back and great to be working with y'all.
Thank you all.
If you have about 30 seconds, I can show the first Zoom I did after I got well enough to do it was last week with a
Oh,
dentist who'd had tinnitus for years in both ears and had been going to physical therapy and ENTs, done all sorts of things to try to get rid of his tinnitus, and nothing had worked. And I showed him what he would have. Apparently, his physical therapist had a laser, and I showed him where he should try to treat in the masseters, in the temporalis muscle, in the cleido part of the sternocleidomastoid muscle, and the digastric muscle. And the first treatment he had with that physical therapist knocked his tinnitus down by more than 50%. And I sent his information to Mike, and Mike has gotten him a laser to try. He's on the faculty of a dental school. So since he's gotten such good results with just one treatment, he's going to try to popularize it with the dentists that he works with. And that was just one
good.
Zoom.
Wow, congratulations. Because I know, I mean, it was one of my injuries was my jaw, and that was a chronic injury, 9 years. That laser is healed me. I don't have that problem anymore. And it was so bad for so long with no solution. And this laser changed that along with my ankle. So, well, I'll just keep preaching the how we love the laser and we love the technology, and light therapy is so innovative. It's so on the forefront of science. And this is why we show up, to help people get through the science part so they'll start understanding the value of acquiring one of these lasers for yourself, for your family, or for your practice. So thank you guys for joining in. We love to you all. Thank you, Dr. Filner. It's joy to have you back, and we'll just keep going and keep educating. And it's just an honor to work with you guys, and we're just getting started on getting this information out.
Thank you. Thanks, Dr. Filner.
Thank you, Dr.
Thank you.
Filner.
I'm glad I'm healthy enough